Nursing school story time. And this one's going to make some of you mad, especially if you swear by certain specific test-taking strategies. Using the ABCs to answer test questions can be helpful sometimes, but nursing students rely on it too much sometimes too. And I'm going to tell you a really kind of funny example why that legit happened to me and my classmates when we were in nursing school many, many years ago. I don't even remember which class it was. It was probably either Med-Surg 2, maybe Community Health. But the test question was basically describing we were on the scene of an emergency situation where there was a house fire. And the fact that I remember this question after all these years, I mean, it stuck with me, y'all. So basically the question scenario says the patient comes out of the house fire, their clothes are on fire, you're the nurse on duty or, who's present, the healthcare personnel present, and you need to take care of them. You notice that there's soot under their nose. And right now everyone's thinking, like, one of the things we memorized was soot under the nose. She emphasized it on the PowerPoints. That is an indication that there's probably like a respiratory burn because like the hot air from the fire can burn inside the lungs, which can cause a whole cascade of problems, basically clamp down the airway. And so we're looking in like at the answer choices and we're thinking airway, breathing, circulation, obviously, airway. So anyway, half the class picks an answer choice that reflects that the priority nursing action is going to be something to secure the airway. And that half of the class was completely and utterly wrong. Tell me in the comments if you would have gotten stuck and chose that answer, because what the real answer was to instruct the victim to stop, drop, and roll so we could put the fire out on their clothes. And of course, once everybody realized this after the fact, everyone's laughing at themselves for choosing secure the airway when the patient is literally still on fire. But it's just an example of why you cannot depend solely on test-taking strategies to do well in nursing school. You have to develop good clinical judgment, because in any other scenario, if the victim's clothing was not on fire, if they were in a safe situation, then securing the airway definitely 100% would have been the correct answer. It would have been the nursing priority. But the thing about priorities is that they change depending on the context. And that's a thing that can make nursing school questions so difficult, which is why how you study matters. And you have to be studying in a way that is preparing you to answer these kinds of questions and to basically develop your clinical judgment. Because you can't just memorize the fact that you always make the victim stop, drop, and roll, or you always secure the airway, because it depends on the context. And so you'll have to be weighing a lot of factors and using your clinical judgment to make the determination. And if you're not practicing that in your study time, then the first time you're going to do it is on your test. And we all do bad on things that we're doing for the first time, especially when they're on an exam. So if you'd like a better way to study, then you should get my Silver Bullet Study System overview. It's a free 10-minute video that teaches the exact 4 steps I recommend all nursing students use to study any topic in nursing school. It mimics the way experienced nurses think so that you can think that way too. If there's a button like at the bottom of this video, click that. That'll take you to the form where you can request it. Otherwise, just go to my profile link and you'll find a link to access it there. And don't forget to follow me for more nursing school tips and maybe the occasional funny story. Good luck on your nursing school journey.